Let's talk about diabetes. So diabetes is when your body has problems with insulin, basically, and cannot regulate or sense your blood sugar levels properly. So insulin is a hormone that's naturally produced by your body, and it signals that your blood sugar is too high and you should probably do something to deal with that. In which cases being increasing the rate of glycolysis to turn that blood sugar into pyruvate where it can be used in other places. The opposite of that is glucagon, a hormone that signals your blood sugar is too low, so you need to cool it on the glycolysis to give your blood sugar a little bit of time to catch up. And perhaps promote gluconeogenesis, which is the opposite of glycolysis, where pyruvate is made into more glucose. Now, as many of you likely know, there are two types of diabetes. So type 1 is a autoimmune disease where your immune system actually attacks the insulin producing cells, and so your body cannot naturally make insulin on its own. It is usually diagnosed relatively early in life, usually as a kid or a teenager, and I think most of the time it is genetic. However, not always, and this can be treated rather easily with insulin injections. The other type, type 2, is not an autoimmune disease because your cells are perfectly capable of producing insulin. It's just the cell receptors have become desensitized to insulin. So you're making insulin fine, however, the cells that respond to insulin are desensitized to it for some reasons, there can be multiple reasons, and no longer respond to it, so they don't react when insulin binds. So even if insulin is signaling that you have too high blood sugar, your body is not going to do anything about it. Now, type 2 is the one that is linked to obesity as well as, just in general dietary things. People with this type is more likely to be obese because their body is not signaling that their blood sugar is too high, so it's not signaling, hey, don't eat this. And so the body is not metabolizing all of the excess glucose, which leads to increased obesity. There's also a third type, gestational diabetes, which is caused in pregnant people, where during the pregnancy the hormones get all out of whack and the insulin is affected by that. So yeah, very interesting. Insulin is a very important molecule in the body.